I was at CMS just long enough to experience part of the Part D rollout, and I don't think the comparisons are apt. First of all, just from a historical standpoint, in terms of getting that site operational, it underwent months of testing before it went up. The site was up for 2 weeks prior to the launch of Part D, so it allowed consumers to go on and actually shop and look at the plans before they can actually enroll, and we were able to work out a lot of the kinks during that time period. We really only had a year to put it together, and I would argue that it had a lot more functionality than the Affordable Care Act website. You were able to go onto the site and effectively put in your drugs and select a plan on the basis of the drugs that you used. This site that they've designed for the Federal Exchange doesn't even let you input your doctor. In some cases, you can click through the plans to see if your doctor might be in those plans, but in most cases, the doctors haven't contracted with the plans yet, so you really have no idea. Only 2 states have enabled that kind of functionality where you can actually look at the plans on the basis of what providers you use, and those are Connecticut and Maryland. All the other states don't have that functionality. Certainly the federal website has nothing next to that functionality. I think that there was arguments that there were some problems early on. There certainly were. There was arguments that some of the Medicaid recipients who were automatically enrolled in Part D temporarily had some snafus in getting coverage. Those anecdotes did crop up. They were fixed very quickly. I think by this time, relative to Part D, most of the problems, if not all of them, were largely worked out. And so this is extending much further, and the problems are much more systemic.